Good morning, everyone. We will get started in just a few minutes.
Reed, I might just add for the benefit of folks who are wondering about the delay. Signe Anderson, our Director of Nutrition Advocacy, is traveling and is trying to connect remotely. And as you will hear, things are moving really, really rapidly involving SNAP. And so we hope to get the latest from her.
Yes, thank you, Gordon. I think she should be here shortly. But we can go ahead and go over some logistics while we wait. So my name is Reed, and I'm TJC's communications manager. I am filling in for some folks who usually moderate. So I usually join behind the scenes. I believe this is Signe joining. Um, Maybe not. Okay, well, we'll go ahead and go over some housekeeping and logistics. Um, Per usual, this webinar is being recorded, and the recording and slides will be sent out to everybody who is registered after. So if you have people in your network who have registered but are not on the call today, all registrants will get the recording and the slides, so no worries there. We'll have time for Q&A at the end of the call, and Signe also has to leave a bit early, so as soon as she gets on and we start her section, we'll also do a brief snap Q&A after she speaks. Here she is. Great. So I'm going to put some instructions of how to use the Q&A feature for submitting questions. You can go ahead and submit questions for tax credits, Medicaid, SNAP, the government shutdown, anything, but after Signe presents, we will take time to only address SNAP questions because she's got to go. All right, and thank you to everybody introducing yourselves. We've got some familiar names in the chat today. So while the effects of the government shutdown are getting sorted out, we are meeting weekly. So our next briefing will be next Wednesday, November 19th. And this should be updated on your calendars. Okay, and then just a disclaimer, the Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. So with that, we will go ahead and turn it over to Signe to present on SNAP.
Hey everyone, can you all hear me okay? Excellent. Sorry, my connection is not great, so I'm probably going to keep my video off for now, but just wanted to be able to join today to give some updates. There's been a ton that has changed within the past week since we've talked to you all. Since last week, I think for those who've been tuning in, you've seen many different changes and some ups and downs. Up until this morning, we were still facing 700,000 Tennesseans without SNAP benefits and $145 million not reaching Tennessee households or the economy. As of this morning, that's changed, and I'll get into that in a minute, and we can go to the next slide. So this kind of gives us a snapshot of what's been happening since we all last talked a week ago. For those of you who are on the line and those of you who weren't, there were a few lawsuits that had been filed before we talked last Wednesday. And one of those lawsuits had required that states get partial benefits to families. And so I'll just take you back to November 4th, when USDA issued a memo to states to send partial SNAP benefits to families because of that lawsuit. And when they sent out that memo, it was quickly realized that many families would not get any benefits based on the calculation. So on November 5th, USDA issued a second memo to increase the partial benefit to 65%. And then on that Thursday, last Thursday, the Rhode Island case went back to court and came out of the hearing with a ruling that required the Trump administration to fully fund November SNAP benefits. Trump appealed that decision on the 7th, but at the same time, USDA sent out guidance and verbal reinforcement that full benefits should be issued. And so states started making moves to put full benefits on SNAP cards. And many states did issue benefits starting last Friday. Tennessee was not one of those states, but we continued to pressure the state to issue benefits. As of over the weekend, there was a lot of back and forth with those cases. The Trump administration appealed, and then on the 9th and 10th, and I'm not sure that this is coming through for everybody, but we'll send out the slides afterwards. But on the 9th and 10th, the Trump administration then told states that they have to claw back those benefits, and asked states to take back benefits, which is really an impossible thing to do. So those states that had issued benefits were scrambling to even understand how they follow those directions after USDA had given them directions to do otherwise. So it's been very, very messy and confusing for everyone. As of yesterday, 2 days ago, Monday and Tuesday, Mississippi and Georgia started issuing benefits to families. And then this morning, we woke up to news that Tennessee had started issuing partial benefits as well. So that's a lot just to go through in the past week. But we are glad that today's benefits seem to be coming through partially, but it's still not the full benefit. So we can go to the next slide and I can talk a little bit about what's happening in Tennessee. So as of today, Tennessee issued partial benefits at that 65% rate, meaning that for folks who get the full benefit, they're getting 65% of that, but then there's a calculation involved where many families are seeing less than that. We've been hearing from families that are not yet getting their benefits. So some families will get their benefits in the next days if their normal SNAP disbursement date is the days that follow today. But even today, I think there's, while this is good that benefits are coming out, it's definitely causing a little bit of confusion, and we're seeing families that should have gotten benefits that aren't. And so the next couple of days we'll be learning a lot more and have more to share with you all. Governor Lee's response continued to be absent as far as finding a way to either get benefits to families. They refuse to use the state rainy day funds. And there's still work to be done as far as getting families full benefits, but we're in a step in the right direction as of this morning. And I think we can go to the next slide. I wanted to make sure that folks had information about how to message for SNAP eligible Tennesseans, for those of you who work directly with people that receive benefits, continuing to let them know that November benefits are delayed, but some SNAP recipients are starting to see partial benefits as of this morning. And if they haven't, they should either be logging into their portal or being on the lookout for their benefits to come in the next days. And also, the other thing that we've continued to message throughout this is that people should continue to submit their required documents on time. Even though the shutdown continues, there are still staff at DHS that are processing paperwork and deadlines that need to be met continue to stick. If folks are eligible for SNAP and are applying for the first time, they should apply. If people found that they got a notice where they're wrongfully denied, they should appeal. Tennesseans eligible for SNAP will receive full benefits. We do not know the details of that yet. So that will be information that we'll share in the hours and days ahead as we get more information. And there is still, like I said, there's still a place for raising your voice and demanding that Tennesseans get full SNAP benefits. And also just sharing the impact that's happened so far. To go 11 days without SNAP benefits is abhorrent. Families should never have had to have waited this long to get benefits, and even partial benefits now that they're showing up is still not enough for families who are struggling to put food on the table. So those are all pieces of information to share with our state and with Congress. And we can go to the next slide. And we shared this the last time. It's a great visual for folks to use if you're trying to get support and demonstrate how people in your district are being impacted by this. So please share this out, and we can go to the next slide. And this is just an action on the SNAP side as far as getting full benefits to families. There's a barcode there. We have an action going out to the governor and Congress to ask for full benefits. While partial benefits are going out, step in the right direction, but we want full benefits and also want our elected officials and people in power to understand the impact that this has done to families. There has already been damage created for many families. So I think it's important that folks know this. While Tennessee has a rainy day fund, people on SNAP do not have a rainy day fund. And so those who have had to make ends meet before their benefits have come out fully have been impacted. And we can go to the next slide. I wanted to share just a quick rundown of WIC for folks that have had their eyes on this. We're still waiting for, once the shutdown ends, for WIC funding to come through at the fullest extent. WIC, luckily during the shutdown, has mostly been protected. Tennessee continues to operate the program. It's important to know that families who are participating in WIC could continue to use their WIC dollars and keep their appointments. That happened all through October and continues into November. The Trump administration did a lot of work to make sure that WIC was funded, and so that has been a blessing for many of the families who are connected to WIC. However, we want to make sure that Congress passes a budget that fully funds WIC in the next in 2026. The Senate bill does that, the House bill does not. So for folks that are watching and following along, we want to make sure that that the bill that passes mirrors the House bill. Mirrors the Senate bill, So there's an action here on WIC. Other than that, I think I might have one more slide, and if not, I can pause for a few minutes of questions if folks have questions, and I haven't been able to keep an eye on the chat.
Yes, thank you, Signe. I've sent directions for how to use the Q&A feature to ask questions. I will send it here again, but we do have a few already. I'll go ahead and get started with. So we have a question that says, I sometimes have clients who are medically unable to work and encourage them to work with their medical and behavioral health providers to write letters describing why they cannot work and date the letter. Do you have additional guidance for these folks? Also, what is a good resource to send people to that need help navigating the SNAP system?
Yeah, you're doing the right thing by creating those letters for your clients. That's the probably the best route for anyone who has medical issues, or medical reasons for why they can't work. We also have resources on our website about how to meet the exemption. And if you have any problems, or if there are folks that you work with that should meet an exemption but aren't being approved, contact us. We're happy to help walk you through the exemption piece, because we've talked a lot about the work requirement and that piece, and it's going to be a challenge in the weeks ahead, and we will be focusing more on that in future briefings. But please reach out to us. We're happy to help.
Awesome. Okay, and then we have two questions. They're pretty short. So, who should we raise our voices to? Should we contact the governor's office, state, or Congress?
Yeah, so we have those codes in on the slides. Congress and the governor right now, because we want full benefits to families. I think it's really important to be reaching out to people on WIC, and we have the link, as well as the scan piece on the slides. And so those are the best people to reach out to right now, and just making sure, first of all, just making sure elected officials understand the damage and the impact this has been to families. We want to avoid this from happening ever again, and we want to make sure that moving forward, full benefits are restored, and that our elected officials, decision makers, are making better decisions in the future to protect the SNAP program and people who rely on SNAP to put food on the table.
Exactly. Okay, and then one more question before you gotta go. But this question is: once full benefits kick in, will recipients get past lost payments?
Yeah, so the way that it's working right now is families are getting the partial benefits right now, and the state will make up the difference of what their total benefit should be. We don't have clarity on that yet, and that's part of the reason why I think it's so important to reach out to Congress and to our state to make sure that if they figure this out, they should be messaging us and making sure that we all have information about when the remainder of benefits are going to come out to families, and if not, they should be hearing from us to ensure that those benefits get out. So we're still keeping our eyes and ears peeled for when the remainder of the benefits will come out.
Awesome. Thank you so much, Signe. We appreciate it. And we do our best. If there's any questions that we don't get to I'll follow up with an email to you with a response from our experts here. But we will go ahead and move on to Gordon. So thank you, Signe.
Thanks, everyone.
Safe travels.
Okay, Gordon.
Thank you. So I'm going to backtrack because of Signe's travel challenges. We put her on first, but just so people have a context for all of this, I would just quickly go through sort of the what happened with the shutdown and the implications of the way this has been resolved for our advocacy going forward. So just quickly, the federal budget year runs from October 1 to September 30th. Congress had to appropriate funds by the beginning of the current federal fiscal year on October the 1st, but the executive branch failed to submit a detailed budget to Congress. This has not happened in living memory, which left Congress to pass a continuing resolution and to temporarily fund. In the House, the continuing resolution could pass with a simple majority, but under Senate rules, which permit filibuster, it requires 60 votes to cut off debate and move to a vote. So because the Republicans have only 53 seats, they needed 8 Democrats to break ranks, or 7 Democrats to break ranks with the majority to get the the CR out of the Senate. And as everybody knows, this is the longest shutdown in history, and it's probably going to end, if it hasn't already, within the next, with votes in the House in the next couple of hours. The Senate again voted a day or so ago, I guess on Monday, after a deal was announced over the weekend. But it had to go back to the House. The House will vote. It'll be signed by the president almost certainly later today. Next slide. And the reason why the Democrats were refusing to sign was that they were demanding a permanent extension of the enhanced premium tax credits that make coverage affordable to 20 million Americans who buy their health coverage under the Affordable Care Act on the so-called insurance marketplace. President Trump had ordered the Republicans not to negotiate with the Democrats, and congressional Republicans were concerned about rising premiums affecting the midterm elections. Bipartisan support was building for extension of the enhanced premium tax credits. Next slide, please. But finally, the pain of the shutdown, with SNAP in particular being taken hostage, forced the Democrats to break ranks and finally agree to end the shutdown. The administration blocked distribution from emergency SNAP reserves. That led to the litigation that Signe was referring to in Rhode Island and Massachusetts, and a series of orders and appeals, which were left everything in limbo. Just to show you the determination with which the Trump administration used SNAP as a point of leverage, when some grocery stores discounted prices for SNAP households to ease the burden on those who had lost benefits and were going hungry. USDA issued a bulletin warning grocery stores that if they did not charge SNAP full prices, they would face sanctions. Next slide, please. The bill that ends the shutdown funds most federal agencies through the end of January and some through September 30th, 2026. In other words, through the end of the fiscal year. Significantly, the bill provides that SNAP funding is insured through September 30th. So as we come to the end of the continuing resolution that funds most of the federal government at the end of January, if there is another confrontation and shutdown at the end of January, the administration cannot take SNAP hostage because it's funded through the end of the federal fiscal year. Next slide, please. So the political pundits say that the Republicans, quote, won this confrontation. They got the so-called clean CR. That means a continuing resolution that just continued the status quo without the additional funding for enhanced premium tax credits. And they basically got that by just holding out and waiting until the pain on constituents forced Democrats to capitulate, or at least enough Democrats to capitulate without gaining any major concessions. The Senate promised the defecting Democrats, the Senate leadership promised a vote in December on whether to extend the enhanced premium tax credits, but there's no commitment by Republicans to vote for an extension. They just said, we'll put it up for a vote. They didn't say they would vote for it. There's no commitment to hold a vote in the House of Representatives on whether to extend the tax credits. Keep in mind that it would require 60 votes in the Senate to overcome what is likely to be an inevitable filibuster. So, and then finally, President Trump has made no concessions to no agreement to improve an extension of the tax credits, even if it passed the Congress, all of which is to say, it's not likely. Next slide, please. that the promised vote in the Senate will have any immediate practical impact. But it's not over till it's over. And many of the pundits are assessing this as a case where the Republicans have won the battle, but they may lose the war, because people are going right now to the marketplace to renew their coverage, and they're being hit with massive sticker shock. In Tennessee, 93% of those who purchase of the 600,000 Tennesseans who get their coverage through the marketplace, 93% of them rely on the premium tax credits to be able to afford it. And if the enhancements expire as scheduled December 31st without an extension, they'll see their costs more than double. And it's expected that as a result of coverage becoming unaffordable without the tax credits, 4 million people, including 200,000 Tennesseans, according to the latest Urban Institute projection, are expected to lose coverage come January. Next slide, please. The Democrats, as you may know, just won a series of off-year elections in several states by running on economic issues and the high cost of living. And those issues are likely to be at the forefront of next year's midterm elections that will control the who has the majority in the House. It's unlikely that the Democrats would take the Senate, but it's a very volatile period. And so the Republicans are worried. Typically, in off-year elections, the party that controls the White House tends to lose seats in Congress. So it will be probably a close contest for control of Congress next November. And the Republicans are worried that this year's election, the ones that occurred last week in which Democrats were so successful, is a bad omen. So there's a lot of sensitivity to this issue and a lot of worry among Republicans. And I think everything needs to be done that can be done to raise this issue publicly, raise awareness of the harm that's being done by the failure to extend the tax credits, and to make the Republican majority sufficiently concerned that they will actually relent and agree. There are bipartisan discussions going on. For example, proposing a 1-year extension of the tax credits, which would have the appeal to Republicans of getting this off of the public debate stage through the next election. People would not be losing their coverage during an election year. So there are ways that we can influence and still get an outcome that will protect people, at least in the short term. And we need to try. Next slide, please. As I just said, the underlying reality here, which is hitting home in households across the state and across the country, is that premiums are just going to become unaffordable. And the number of uninsured Tennesseans without congressional action will rise by 41%. Next slide, please. And I won't go over this here, but the amount that people will be paying with and without the tax credits it depends on family circumstances, household size, and income. And so it's highly individualized. However, the Kaiser Family Foundation has created a tool to do general estimates, and we've included a slide here that shows what the changes would be for a single person household, and another slide, next slide, please, for a household of 4, just as examples. So you get some idea of the magnitude of what people are facing. And you'll get these slides afterwards. We'll email them out, and you'll with the links to the underlying sources, but people who go on the marketplace right now to shop for an extension of their coverage are being just overwhelmed by what they're facing in the way of increases next. And that's not going to get better. It's just going to continue to build between now and the end of the year and into the next year unless Congress acts. Next slide, please. I'm just going to quickly touch on the Rural Health Transformation Program. We've gotten a bunch of questions about that. Just a quick refresher, the One Big Beautiful Bill Act, also known as HR 1, the mega bill that the president signed into law on July 4th, and that was passed with no Democratic votes, and in fact by single votes in Congress, in the House and the Senate. In the Senate, it actually required the vice president to cast a vote to get it across the finish line. So it was very controversial, and it covered huge terrain. It basically took $1 trillion out of federal money out of Medicaid over the next decade. And when you look at the knock-on effect of removing the federal matching dollars, what that does to state matching funds for the same program, experts estimate that it's a $1.3 trillion loss to Medicaid. And as probably everybody from Tennessee knows, we lead the country in the rate of rural hospital closures. There's a real crisis in rural health delivery across the state that's been building over the years. And we now have large and growing healthcare deserts in particularly on the parts of the Cumberland Plateau and in rural West Tennessee. And we got a reprieve during the pandemic when Congress sent out a lot of additional money to help providers tied over during the pandemic. But that money is now gone, and we're back into a situation in which hospitals are really in trouble. In order to get or at least many rural hospitals are, in order to get the support of several key Republican senators, the White House agreed to create a so-called Rural Health Transformation Program with a $50 billion fund. $25 billion is to be allocated more or less equitably across the states, and $25 billion to be spent really at the discretion of the administration. So we don't know how that's going to be spent. Last week, on November the 5th, is the deadline, the Tennessee Department of Health submitted our state's application for money from the Rural Health Transformation Program. There's a link here. You can go and look. It's just very general. Doesn't say much about how we would spend the money. For a detailed critique of the program and its limitations, we've included a link from KFF, the Kaiser Family Foundation. Next slide, please. All of which is to say, we don't know very much about the details of whether or how Tennessee will get money, but we do know a couple of major things, which is we have known that for years, rural communities are disproportionately reliant on Medicaid to provide health coverage and fund local hospitals and clinics. Rural communities are generally poor, and in any event, generally the employers there are not as likely to provide coverage. People are less likely to get coverage through employment. So Medicaid, and to a lesser extent the ACA, are crucial in rural communities, both for providing coverage and for paying providers. And they are going to be disproportionately impacted by the $1 trillion cut to Medicaid and the ACA. And lest we get hopes that the Rural Health Transformation Program is going to compensate for that, no more than 15% of the grants can be used through this new Rural Transformation Program can be used to pay providers for patient care. So it really is a drop in the bucket compared to what the One Big Beautiful Bill does. So just that wanted to share that. Again, we don't know the details, but to the extent that any of us were hoping that maybe it would extend a lifeline to rural providers, it's not really going to compensate for what's coming down the pike in terms of Medicaid cuts. Next slide, please. And I think the best summary, actually, and this has been quoted nationally, is from the director of the Center for Rural Health and Research at our own ETSU, Michael Mead, who said that the rural health community is excited about the innovations the new program might foster, but he, quote, love for it to happen in the absence of these cuts that are going to devastate our rural health system. It's not going to fill the hole. And we've included a link to that quotation there. Next slide, please. So I'll turn it back over to you, Reed. But I think the main punchline for health is that the enhanced premium tax credits are still at the forefront of the political debate, and we need to let Congress know that we're very disappointed that we're glad that the shutdown is ending, but we're disappointed that it's ending without taking care of the urgent needs of the people who rely on the enhanced premium tax credits to cover their families, and with the additional impact that will have on healthcare providers. Thank you.
Thank you so much, Gordon. Yes, so I just put a bunch of links in the chat. All of this is also accessible on our website, specifically tnjustice.org/join us. Everything's been changing like the wind blows, so we've been updating everything on this website. It has updated advocacy to take, which we've just gone over today, as well as food resources, things like that. So I just put all the links to this in the chat, but this is just a recap of what the advocacy action is now. We also encourage you all to follow us on social media if you're not already. You can find all of our handles at tnjustice.org/socials. You just click on the one you want to follow us on. You should click all of them if you're plugged in all of those platforms. But we've been sharing everything on social media as well as emails. Just subscribe to our emails if you're not already. If you're on this call, you likely already are. So we encourage you to forward it to 5 friends who maybe aren't familiar with TJC or want to be in the loop on what's going on. So again, all these links are in the chat. We also encourage you or maybe the clients that you work with to share their stories with us. Maybe they're on Marketplace or they've been impacted by the delayed SNAP benefits. So stories are a big way to move hearts and minds by with our elected officials. So we offer 3 ways. You can find all this information at tnjustice.org/stories. I just put all of that in the chat as well. So we will open up the floor to Q&A. We have some questions already submitted. The chat is not being monitored for questions because I'm putting all of the resources in the chat. So please find the Q&A feature to ask questions, but we'll go ahead and look at what we have so far. Some of them are SNAP questions. So we have a question asking, will federal employees get paid, assuming after the government is reopened? Gordon, if you're able to answer that.
Yes, the deal that was cut to get the Democrats that crossed the aisle to vote in favor of reopening, the government does provide for reinstatement of employees who were furloughed and payment. So I think that's good news.
Great. Since the enhanced premium tax credits are ending, will taxpayers still be required to have health coverage?
The short answer is, I think, no. People may recall that the original version of the Affordable Care Act required people to carry coverage, and there were penalties similar to those in many other countries if people failed to maintain their coverage. But that was removed or watered down to the point of being pretty token. So if there is a penalty, and I frankly don't remember at this point, if there may be a nominal penalty, but I don't think it'll be significant. The real harm, of course, is that people live with the terror of being uninsured and know that if they fail to carry insurance, a single trip to the ER can ruin them financially and ruin their families. And that, if they get really sick, they may not be able to get care. So it's always struck me as someone who's dealt for many years with people dealing with the terror of being uninsured, that the idea of threatening people with sanctions if they don't carry insurance, that's not to say there isn't, an 18-year-old male out there somewhere without a fully formed brain who thinks, he can just live on the wild side. But I think most mature adults just know it's essential. And the only reason why they're not doing it is because it's not affordable. So that's where we are.
Right. So these next two questions are about, one of them is about SNAP, and then one of them is about immigrant eligibility with the HR1. So if we would rather leave the SNAP question to Signe, we can, but I think you'll be able to address it. So it says SNAP benefits are safe until the end of the fiscal year. When is that exactly? Is that October 2026?
Correct. Yeah, the deal will protect SNAP benefits from another disruption through September 30th, which is the end of the federal fiscal year.
Great. And then this next question, has Tennessee implemented the immigrant eligibility changes from recent USDA guidance that was implemented through HR1?
Short answer, I don't know, but because that was the law, I assume that DHS has already implemented those changes.
Okay. Well, that's it for our Q&A. We still have about 15 minutes left. If people have questions, please utilize the Q&A feature, but otherwise I will just keep moving along. So another part of the call to action is to register to vote. So also confirm your voter registration. Maybe you recently had your name changed, things like that. So just again, like you recently moved, so confirm that all those details are correct. Also follow TJC on social media and stay informed. We email verified updates pretty regularly, so forward this link to your network to also sign up and stay in the know as well. Our next briefing is November 19th. Again, as long as the government remains shut down, we will be meeting weekly to get things sorted out. We thank you for your patience as we've shifted from weekly to monthly to weekly to monthly. So right now we're weekly. We'll let you know if that changes. I see some people dropping off. So if you have to
Can
go.
I just make a
yeah.
last minute pitch?
Mhm.
To renew our request for stories, particularly of people who are affected by the expiration of the enhanced premium tax credits. TJC is a major source of stories, thanks to folks like you, to the media, not only in Tennessee, but actually outlets like the New York Times, the major news networks, the Washington Post, the LA Times, and that's based on the relationships that we have with folks who are affected. So if you or someone you know of is affected by these, please put them in touch with us, because we are in a battle for the hearts and minds of Americans, and those stories really move the ball. So thank you.
Thank you, Gordon. And yeah, again, we offer 3 easy ways to do that. You can call, leave a voicemail, you can email, you can fill out our form at tnjustice.org/stories. All of the information is confidential unless you give us permission to share it. We will not share anything without your permission. So again, all of that information is at tnjustice.org/stories. If you have to go, please take a moment to fill out our feedback form so we can keep doing our best. I do see 2 questions that just came through. Gordon, if you're able to, oh, someone has an announcement to let people know early voting started today in Congressional District 7. So thank you so much. Register to vote and check your registration if you're in that district.
I see also that Ann Lucas, thank you, Ann, suggests get insurance plan on ACA before December 31st, hoping to get EPTC. The deadline for enrolling is December 31st. If ultimately Congress decides to extend the enhanced premium tax credits, that's great. If they don't, you can cancel before you have to actually pay the premium. So you have to pay the premium, I think, by December 15th to get coverage in January. If you pay it after that, it starts the month after you pay it. So the logic here is go ahead and sign up. It's free at the moment, free as in the sense that you don't have to commit to it if the enhanced premium tax credits are essential for you to find it affordable, and if they are not extended. It turns out they really are not extended. By the time you have to pay, you can just drop it. So thank you, Ann, for that good advice.
Thank you all so much. We'll go ahead and wrap it up there if there's no other questions. Thank you, Gordon. And I think we have, all of our events are at tnjustice.org/events, but if you're interested, there's a Protect TennCare Medicaid Coalition. You can sign up for that here for anybody interested. And then here's our contact information if you have any questions, but thank you all so much. Have a great rest of your week.